Good afternoon and welcome to the Alfred University Bergren Forum. The disembodied voice that you hear is not that of the cadaver on the screen in front of you, but instead John D'Angelo, professor of chemistry and the coordinator and host of the spring 2025 season of the Bergren Forum. This is episode 6. Today's date is Thursday, March 6th. And for those of you attending the forum online here in Western New York, it's a nice but not quite warm day with some breaks in the clouds, but inside Nevins Theater or the Powell Campus Center, it is cozy and the coffee and tea are hot and free. Before starting, we have a few announcements. First, next Thursday's forum will be given by nobody since we are on spring break, but the following Thursday will be by Matthias Homar. Matthias's talk will be on enactive composition as a social and personal endeavor. There are some other announcements this week to announce. For those students interested in purchasing a class ring, representatives will be in the Powell Campus Center lobby on Thursday, March 20th from 11 until 3 p.m. and in the Joyce Walton Annex at McLean Center McLean Center on Friday, March 21st from noon until 3. After break from 11 a.m. until 12 p.m., the Center for Academic Success will have academic consultants in the nightclub from 11 a.m. until 12 p.m. on March 17th to assist students in setting goals after midterms. St. Patrick's Day treats and prizes will be available for attendees and participants. The Gibbs Fitness Center and Joyce Walton Center hours for spring break will be 6 a.m. to 6 p.m. Monday through Friday and 10 a.m. to 6 p.m. on Saturday and Sunday. For anyone in town over break, on March 11th from 2:30 until 4 in the link, there will be a paint and sip with mocktails by AC Jetty. After break on March 17th from 6:30 to 7:30 p.m. in the Schultz Lounge, there will be an event providing Texas Roadhouse rolls. The Psychology Club is hosting an escape room on Friday, March 21st from 5:30 until 9:15 p.m. Check out AU Connect to reserve a time. Cost is $8 per person and is payable by cash or Venmo only. Finally, on Wednesday, March 11th from 3 to 4:30 p.m., which is during break, there will be a live virtual artist talk and Q&A during break by Ruben Telushkin, led by MFA candidates Cameo Chambers and Charlie Mannion. Check out AU Connect for the Zoom link. So with that, today's forum will be given by Jen Gordon, Alfred University Assistant Professor of Biology. The title of the talk is Discovering Anatomy in the Digital Era. Take it away.
Thank you. Welcome. And I'd like to believe that you're all here to see me, but you're really here to see him. I know, I get it. I'm going to start with just a bit of information about this amazing tool that we have in the Science Center in the Lab 306. It's used for a whole wide variety of classes. And hopefully I'm going to take a minute to also talk to you about how we're using it in the research realm as well. We're in the process of, we have 2 years worth of data collected now. The data is now being moved on actually to Anatomage. I'm hoping to be there in July to present all of our research that we've done so far in our courses and share with other educators who are using the table. So yes, this guy is great. Welcome to our cadaver. A little bit of information, maybe. So Anatomage began building these tables right in around 2010. So it's been about a good 15 years that they've been working on this particular project. I can tell you that I had the honor of having one in my lab in 2014. At the time, there was 1 cadaver inside the table. Now we have 5. We have a dog and a cat. We have an alligator. We have a vast library of CTs and MRI scans. So this table is more than just a teaching tool. It covers a vast amount of information that is used in a multitude of classes. Here's just a little bit information on what exactly you can find in here. Yep, I talk about 5 cadavers. There's a library of CT and MRI scans. I'm going to pull up a few. The really amazing thing is that this cadaver, well, he just disappeared. You're like, wait a minute, where'd he go? is fully integrated. So that doesn't mean we're just looking at one plane all the time. We can make them bigger. Oftentimes, students are so good at using this that he'll start to fall off the table after a while. It's okay. We just put them back on. No need to worry. We can use this in a number of different dissections. Now, the cadaver you're seeing up here actually is a cadaver that none of my students have used in class yet because he was just added to the table. This is Hans. If you're wondering if these are in fact real humans, they are real humans. The Human Body Project out of Korea in the early 2000s allowed scientists to image human bodies by cutting them and taking images and then re-establishing, redigitizing all of those images back together into the cadaver you see. What we have the benefit of getting out of this, simplistically, I guess I can cut them in half. This allows us to see information from anterior to posterior. All I'm doing is looking at internal organs, right, from a plane. Now, this is really nice. We can get a good relationship. If you're wondering what part of this gentleman you're seeing, you're like all of a sudden he looks really flat. It's fine. I'm sorry, I just took his front side off. This is an amazing representation of where organs are located. You can understand from an internal component, liver, kidneys. So students get a much better understanding of human anatomy based on how these scans are interpreted. This is when I like put them back up. It's more than just the ability to see things from inside out or even cut planes. You'll notice that all I did at this point was I just allowed you to see a certain number of systems. So the skeletal system, a bit of the digestive system, and part of the respiratory system. Again, the same things can happen. That means we can still cut him, which now you're seeing sort of a completely different sort of cut, right? I've instead made a plane right down the middle. So now you're looking from the side. And the same thing as we're looking at relationships and different components of the body, where they relate to each other, this allows us to move that information. And again, I have the ability to control what the students are getting out of this, right? So perhaps if we're only working on the skeletal system, it's very easy for me to just leave the skeletal system. And so now students aren't necessarily distracted by all those internal organs, and we can look at skeletal nature, so to speak. It's not just all of these awesome digital cadavers. The CT MRI scan library takes all of your CT scans, puts them in a 3-dimensional image, which is something you probably don't see when you go to the doctor's office. If they're reviewing a CT or an MRI scan with you, you might see a black and white image and they kind of scroll through. You're not quite sure, is it a bone, is it a muscle? So we'll look at some of the CT scans that are in here and then talk about how we're using them, not just for teaching tools, but also for research. In the last year, they have added physiological information, which means I'm going to pull up a beating heart. You'll be able to see a real-time EKG. We even have the ability to alter that EKG and simulate a myocardial infarction or aortic stenosis. So a wide variety of diseases and pathologies also exist in this little box. We also have a huge library of animals, thus helping our animal science students who are going hopefully to vet school. They get a jump start on getting to see not just cats and dogs that we would typically do in the lab. They're also seeing those things in here for the first time. Our students are 100% more prepared for medical school, PA school, PT school, all of those advanced sciences in the allied health. We're putting students ahead of the game as undergraduates. As far as I know at this point in time, we are among 5 institutions in the state of New York that has this amazing piece of technology for our undergraduate students. If you'd like to know other schools that are using them, Stanford Medical Program uses it exclusively for their first year anatomy courses, as does UConn Medical, NIH. There's a whole variety of medical students and medical schools who have taken this over to replace the costly cadaver labs that they used to have. So what does that mean for research? We started this project in the fall of 2023. The premise behind it was developing what we call a cure. Now, a cure is, for those of you who are unfamiliar, it is course-based undergraduate research experiences. The idea behind it is that we're hoping to teach learning concepts and allow students to master these rather challenging concepts through a research problem where they will actually create the problem, do the review of literature, define variables, collect data on those variables, and then look at the conclusions and how we can present that material. Now, throughout the process, not only are students learning scientific method and what we know is current research, but we also know that they're learning information about anatomy and introductory biology, which is one of the reasons why we're in the process of developing a cure specifically related to collecting data with, don't panic. He's like, and it's gone. Okay, so while we wait for those to pop back up. CT and MRI scans, okay? So this is an example of one of the amazing things that we can see in this table. This is a CT scan. It has been digitized in 3 dimensions, right? So again, unlike most CT scans that are a flat 2-dimensional image when you look at them in the doctor's office. Oh, okay, don't touch it. Okay, which is perfect. As you're looking at this particular CT scan, you should notice a ginormous abnormality for this particular individual. For every CT scan or MRI scan that is in our table, there is an information panel which tells us information about what the pathology was, potentially information this came from a 35-year-old female. All of the case study notes that were from the doctor's office are also listed in the information panel. So from a teaching standpoint, we are capable of teaching students about advanced pathologies well before medical school or PA school, simply because they're on this table. If you're wondering what this particular pathology is, yes, it is a ginormous abdominal aortic aneurysm. They call that a AAA if it were to rupture. So this is very important that she happened to get it caught at the age of 35. Medically, they will be able to put a stent around this. It's sort of like putting a cage around it, a little bit of a fence. That way it decreases the chances of this particular end of the aorta rupturing. Again, a rupture of the aorta in this location might give you 2 to 4 minutes before death. So this is a huge tool that we're able to share for students. So going back to our cure research, I put our problem statement up here. I know I have a number of students in this room right now that came from both semesters of Bio 155. They had the honor of collecting all of the data that you guys see up here. Our research or a problem statement came from the concept of, if somebody was walking down the street and they picked up a CT scan off the floor and it didn't have any identifiable information, could we begin looking at that CT scan and determine if it is a male or a female? Previous research has given us a whole bunch of information that we do know that there are certain measurements that can be taken on the skeletal system that show us males and females are significantly different. We know that all the measurements of the major long bones of both the upper extremity and the lower extremity are all significantly different between males and females. Our students took the time to go ahead and measure those things as well. We're simply continuing on to show, yes, we even found those significant differences when we used our CT scans on the information that we used in class. Over the course of 2 semesters with our students, they designed 40 variables that they chose to test to determine differences between males and females. And I'm super proud at how diverse the entire student population was. It wasn't just about looking at long bones, because those are pretty simple, right? We had a group. Here's an idea as to some of our groups and some of our variables. The upper extremity group, yes, looked at the long bones. Not only though did they look at the length, they also looked at width and diameter of several different locations. So if you can imagine the amount of data that we pulled from doing that. The long bones are humerus, radius, ulna. They sort of had a bit of the responsibility of testing the previous research, right? We're going to validate the significant differences that already exist. Our trunk data and our trunk group probably had the most challenging task. And the students actually thought outside the box and aimed for ribs. If you could imagine, that's an arc measurement and not a straight line. The data was a little bit challenging to collect, again, when you have 40 variables, I sort of had to pick and choose which ones to share with you with regards to significant differences that we found. The pelvic outlet is already known significantly between males and females. In other words, because females engage in the birthing process, the opening of their pelvic outlet is in fact different and bigger than the opening of the male outlet. We were able to confirm that data as well. And they took it a step further and looked at what we call the pubic arch, which is an angle measurement between the two bones that create our pubic bone. Head and neck group, same thing. I had some really advantageous students who chose to look at not only the diameter of the skull, but the diameter of the brain as well, because, well, we can see that. So for example, this is a CT scan. This is an example of one of our scans that our students would use. I did put two measurements up there, and they're small, they're challenging to see. So we have a measurement tool on the table that is a ruler. It allows us to engage in measurements in millimeters, centimeters, or angles and degrees. They also do circumferences. So our students became actually pretty fluent in being able to measure a whole cascade of things on the CT scans that are in here. Now, if you're wondering, you're like, well, how are we going to do brain circumference, right? This seems kind of simple. You're like, oh, that's great. I can see skull circumference. Similar to the way we could cut so I'm like, bear with me, right? So all I did was simply cut that. And so now you can see the cavity of where the brain goes. And so again, this is where students not only measured the outside of the cranial cavity, but they measured the inside as well, which is a totally unique measurement. The second thing, which is why I happen to put this picture up here, is that the foramen magnum is the hole, the base, where the base of the skull and your spinal cord begins. So your brainstem comes out there and then continues down into the spinal cord into your back. For the first time, we're actually hoping that with additional data we only collected this for about a semester, that we are pretty close to finding significant differences between males and females in the length and width of that particular space, which is potentially a new significance that we're hoping to share with the population to say, hey, we think we found another variable that indicates differences between the two. And then the lower extremity, I know Wonder Woman is one of my favorites. So here's an idea of some of the things we found. And I know you guys are like, oh, this is great. Research is fun. What else does this guy do? Hold on. So here's an example of some of the results from our upper limb group. You can see that there are significant differences, p is less than 0.05, in all of the long bone length measurements. Because we had 40 variables, I didn't go ahead and put all of our length and width measurements up there because, again, same thing, there was just a lot of data. This is where I was talking about a moment ago, where this is sort of the first time we're seeing a significant or nearly significant difference between males and females on the measurement of what they call that foramen magnum, that hole where you have an exiting space for the brainstem. So again, we're hoping to sort of move forward on results like that. These are really nice to see because, again, we had some inlet and outlet circumferences. That just depends on the angle in which you're looking at the opening of the pelvis for males and females. And hopefully you can notice that there are places where there is significant difference. We know this, but we also know that when it comes to the inlet size, there are no differences. So we have to be a little very specific about what we're going to measure if we're trying to determine differences between males and females. The same was seen between inlet diameter and outlet diameter. Finally, of course, we know all of the long bones of the leg are really significantly different between males and females. And you can see that from really how extremely different each bar is for both of those. And again, our students enjoyed hopefully being able to validate some of the results that already exist, as well as come up with factors that were unique that we're hoping to continue to test. So now what? You're like, cool, now what do we do? Well, the next step of our cure research process is to now get into the qualitative data, which is a little bit more challenging, to create statements and concepts to determine what the learning process was for students engaged in this process. So this process takes a little bit long, developing questionnaire questions, adding scaled information, and trying to determine and sort of pick out, is this really an adequate way for us to teach intro to biology or even potentially anatomy and physiology for students to learn the concepts through a research study, which is unique. And as much as I'd like to hang out with that, you're like, cool, what else does this guy do? Well, a whole bunch of stuff. So I've talked a little bit about humans. What about our animal friends? So this is our beagle. He is our dog cadaver that's in the table. He is fully segmented and annotated. So similar to the human cadaver, right? And you're like, cool, yes, I can put him anywhere. Similar to the human cadaver, I can choose which systems I would like you to see. So if I want to get into, I'll take that one out. Right, so now we're basically looking at the musculature of the dog, right? And again, so for our human science or our animal science majors who are going to vet school, it's usually pretty common for students to dissect cats. So they get that hands-on information with cats, but almost rarely never dogs. So now instead of having to hopefully teach them the concepts of the dog through images or even models, we have the ability to do that with our cadaver. And similar to our human, we can show all of the internal organs and components as well. Now, if you're wondering why all of those organs are missing, remember, I actually just decided to pick and choose muscular and skeletal systems. So if you're wondering, well, what do students do with this? How do they learn this material? Well, the nice thing is that any one of the muscles or structures that you touch on the cadaver will tell you exactly what it is. So I just clicked on the flexor digitorum muscle of the dog. So it's sort of like a checks and balances system. We can leave all the labels on here. That means I can pull up every label of every structure that is on this dog, or we can, which my students who are sitting in front of me will probably tell you, we can play a game. Not only is there a quiz mode set up in here, but there's also a game mode set up in here. The game mode has a tendency to become a little bit of a contact sport, right? We've had to sort of make sure that there's no warding. It's like Jeopardy, right? First team to ring in will get to answer the question. And students have told me frequently that that is one of the most favorite things that they like to do at the end of our labs, is to grab two teams, go head to head, name as many structures as they can, which is pretty amazing. Other friends. So I talked a minute about physiology, and this takes anatomy just a little bit of a step further. And this is actually one of the newest features on our table. I apologize because I know some of the information is down at my feet. This particular organization of the table I could not switch it into a different mode. So what you're looking at right now happens to be the heart. What is on the bottom of the screen is a live EKG. So if you've ever gone to the doctor for a checkup or even ended up in the ER, and you have all the electrodes put around you and you wonder what it does, well, it's measuring basically the electrical conduction of your heart. The electrical conduction gives us an idea or an inference into the mechanical idea. So if we know it's happening electrically, we can assume what's happening mechanically. If there's an electrical problem, it may indicate a mechanical problem. So an EKG, for example, I can now add this in motion. Students can now not only see a beating heart, but they can also see how the electrical information is produced, and at the same time, they're watching it beat on the screen. Even cooler is, well, let's look at the way the valves open and close. So this means that with each cardiac cycle, with each beat of the heart, now we can understand the opening and the closing of our semilunar valves and our AV valves. So those are our flap-like valves. Oftentimes people know conditions such as aortic stenosis or even mitral valve stenosis. The valves of your heart should be flexible. I often say something like a cooked ziti noodle, right? Nice and pliable. Now, what happens over time and with disease is that those vessels become hardened, or the valve itself, the flaps, will become hard and stiff, sort of like an uncooked ziti noodle. So if you can imagine the chances of something that is more rigid has a greater chance of breaking. With your cardiovascular system, we always need blood to be flowing in one direction, okay? We never want backflow. Backflow creates issues in both the lungs, but it also means we're reversing things from oxygenated to non-oxygenated. So it can create a number of conditions. Now, when you have something like aortic valve stenosis or mitral valve stenosis, those valves will break, and that means you will hear backflow. If you've heard somebody say, oh, I have a heart murmur, right? You can listen to it. You'll hear a very sort of a swooshing sound when you go to listen to the heart sounds. That swooshing sound is an indication that blood is flowing backwards. So then we can go a step further, have an angiogram or an ultrasound to determine what is the status of those valves. So here, our students actually get to see those valves physically working correctly. In addition, if I would like, this gives us more of an indication if you were to have what they call a lateral MI. An MI is a myocardial infarction. This means that somewhere in the heart, one of the major vessels that is feeding the heart blood has had a clot in it. That means the heart muscle itself did not get flow. If the heart muscle doesn't get flow, it will die, and then it won't function anymore. So what we know about myocardial infarctions is that they happen in stages. Oftentimes they are small, tiny events that lead up to one much larger event. With a lateral MI, only part of the heart tissue here, and you guys can see it a little bit, has deteriorated. That means there's been no flow to this side. On a good note, there's been flow to the left side, so the left side is still functioning well. Now, over time, the more tissue death that you have, then we start to see issues with blood flow and problems in the whole system. So our students are not only able to see different pathologies, again, I just pulled up a lateral MI, but they also get to see what it looks like on an EKG. One of the things that I'm happy that our students get before they leave anatomy and phys is that they know how to analyze an EKG on a minimal basis, which is second level or typically second year medical school or PA school information. Our students enjoy looking for things like abnormalities. We talk about how can I look at this picture down here and understand, how can it tell me where there's a disease or a disorder up here? So again, as a population of undergraduate students at Alfred, our undergraduate students are not only getting a research base from this table, they're also getting a much more advanced education because we're able to show them so many different pathologies and so many different ways that the body functions. Like slightly different, and you're like, oh, cool, yes, I can still move it. Is that some conditions or cases are related to the what we call the conduction system. So a little bit of what you see on the screen right now, hopefully, is that you see the lines that are alternating from yellow to white. Okay, those are the electrical pieces of your heart. The really nice thing about the cardiovascular system is that it can function by itself in the event that information to the brain from the brain is no longer going down there. So this allows us to show students exactly what part of the heart we are looking at when we're trying to measure an EKG. If you're wondering about the disease I just put up here, this is first-degree heart block. This basically means that information is not getting from the top part of the heart down to the bottom part of the heart. Okay, and again, we talk to students about how can we recognize those things on a sheet of paper with waves instead of having to become invasive and look at something that's inside the heart. So fun with CT scans. I'm like, it's all about CT scans today. This is a CT scan that, again, is in our library of CTs. I like to use this as an amazing learning tool. Yes, because it is a CT scan. If you're wondering, yes, it is also a set of conjoined twins. Okay, now, it is nearly impossible to see something like this, either from an undergrad or even in medical school, right? Unless we're looking at CT scans or MRIs. This scan was done in an attempt to hope that we could separate these two twins. It looks right now as if they are conjoined at the sternum. So you should notice that the base of the sternum right here, they have one. It doesn't quite continue down as far as it should. Our sternum should go much further into the thoracic cavity, and it's not. From a heart standpoint, again, because we can look at this as a CT scan. In other words, you notice, hopefully, that each twin has its own separate functioning heart, which is oftentimes when you're looking at separation of conjoined twins, what are their shared organs, right? And how do we have the ability to split those shared organs? Sharing one individual heart obviously is nearly impossible to split. So the nice thing from looking at this from a scan level is our students can identify different structural places where we think we can separate these twins. And it looks really great right now. Like, this is going to be a great case, right? They have two separate hearts. We can do bone grafts to correct the rest of the sternum. These guys could have a pretty functional, independent life. We also have the ability to take our CT scans and change them in the vision of what you are seeing. Yes, I could turn this into just an X-ray. So we're not looking at internal structures, right? We're just looking at bones. I added, in addition to our bone structure, I added some of their internal organs. So this is what we call soft tissue. And again, in a typical CT scan, if you're looking at it in the doctor's office, it's almost impossible to pull this information out unless you're a specialized radiologist who focuses on this. So the challenging part for these twins, unfortunately, is that if you look in their abdomens, you might notice two totally different types of structures. Yes. One twin has more of this lighter component. The other twin has far more dense material. What you're seeing is the small intestine and the large intestine. So unfortunately, during development, each twin took one portion of the digestive system and the other one did not. So they share a conjoined digestive system. Again, it seemed pretty open on the top part to being able to separate. And unfortunately, because of their shared digestive organs, they were not able to successfully separate them. Or it would have been a choice between having just one twin keeping all of the internal digestive organs and not the other, right? So if you can imagine, these are the challenges. I feel like if you watch Grey's Anatomy lately, or even some of those new age, right, emergency room shows, they're using some of this technology on those shows. They're showing you, hey, we can take images of these, we can three-dimensionalize them and allow us to see more so that we can prepare for something before they get in. So if you can imagine, before technology like this, they would actually start to decide, hey, let's try and separate them, get into the middle of the process and go, oh, we can't, right? So now we can sort of save half of that procedure from happening, right? There's a lot of clinical cases in here. I spent 12 years working in a cadaver lab for a PA program. We would have 12 cadavers a year. I can tell you that of the hundreds of cadavers that I've seen in my lifetime, there are far more amazing things that exist in this table than we could ever possibly have. So it's an amazing tool for us. And I'm like, okay. That being said, is there anything that you want to see that you didn't get to see? That's a phenomenal question. There are massive advantages to using cadavers. It's tactile, right? It's structural. So yes, you do get the experience of physically being able to move things out of the way to get to other structures. I think there are amazing advantages to having a cadaver that you can actually work on. Unfortunately, right now, cadaver donations have gone into the minimum. So this is the lowest number of cadaver donations we've seen in decades. In addition, and even like I said, medical schools for first-year anatomy are starting to take over this process and save the cadavers that they are getting to do component research or variable research, if that makes sense. So in other words, when they're going to do a surgery, say of open heart surgery, they're saving their cadavers for those processes and not necessarily for just dissection. So I do think in a perfect world, in a perfect scenario, which I like to think we have in our lab, is that there's a combination of models, three-dimensional items that you can touch and feel, dissections. So our students experience doing dissections of cats, hearts, kidneys. So they're still getting that dissection concept. And they're getting more information from seeing it digitally and how it's presented here. So it's definitely a multi-tool sort of classroom. And I do believe that all the pieces together are what make us, or really what make a most successful lab. The cost of this is a fraction of what it would cost for a cadaver. Because with cadaver sciences, not only do you have to purchase the cadaver, you have to have the right storage space for the cadaver, which is a refrigerator. You have to have a ventilated table for the cadaver to go on. You have to have sterile tools. So the expenses of a cadaver lab can be high. And so this was sort of the best option to get more students available to see the things that we don't see on cadavers. This particular table is about $100,000. Again, in comparison to a cadaver lab, this is a fraction, which is kind of nice. Like I said, the updates that they continue to put out on our table have been more than I ever would have dreamed when I started working with this 11 years ago. Like I said, 11 years ago, there was one cadaver in here, a couple thousand CT scans. Now we have 5 cadavers, full library of animals, 2 annotated, 1 cat, 1 dog. My best friend, nope. My best friend, Colleen. So this is really like, yes, this is in fact, this is Colleen. She's a baby alligator. So in addition to a number of the things that we get excited to see, like I said, our animal science students get to use these for comparative vertebrate anatomy. So what are the similarities and differences between humans, turtles, birds, cats, dogs, alligators? And the nice thing, because this is a CT scan, and you're wondering she was sleeping when they did the CT scan, is that as we look at structure and components that are inside, she has the exact same heart structure that we do. It's a 4-chambered heart. It looks almost identical to ours. Lungs are pretty much situated in the same place, liver, and we can go further into identify different organs, vessels. So being able to have a comparative situation where we can compare an alligator even to a human is huge. And most labs don't do that, right? So that's why I said The vast amount of information that happens to be in this guy is really intense. Our CT scans, like I said, you can cut them. Because they are CT scans, nope. This is what I'm like, right? So I can potentially cut it so that you can see more things on the inside. Because it is a CT scan, it doesn't look quite as nice as the cadavers did. So you have to sort of sort out a little bit of information. Right, but you can see I have so many different capabilities with each scan to show you a different angle. So now we're able to see with this view more of the internal organs, right? So now we can assess the digestive organs, the lungs, all of the soft tissue, and that is a really beautiful heart. I'm like, I want that one to beat. Again, from a comparative standpoint, and I think our students are pretty excited. It happens to be that right now we have about 5 different types of hearts in the lab so that students can see exactly how similar we are amongst a number of species. And for example, how our reptile population has a 3-chambered heart, which is completely different because they have the ability to not send blood to the lungs. That's what allows them to conserve energy, stay underwater longer. So it's a length of time thing from if the weather is cold or if they're in danger, they have the ability to turn off their lungs and then just rely on circulation of blood from the other 2 chambers, which is pretty impressive. Yeah, I actually use Colleen quite a bit. Elijah? I know that they were in process. What is it, Meta? I'm like, where's that little device that my son uses? There was a plan to work towards that. Where that plan is right now, I don't know. What I do know is that Anatomage is working towards that as well. And a lot of, which is why I think I had put up earlier, some of their tables now are totally different than the one we have, right? So several of these, right, your smaller, they're starting to put these in doctors' offices to make explaining certain tests and information a little bit easier to a patient. They're also being used not just in medical school, but in nursing school. They allow you to do procedures on them. So there's a cath lab in here. We have the ability to do an ultrasound. So they're practicing those things here. The next step, I believe, is to make it more like a VR. I don't know how close we are to that reality happening, if that makes sense. Question? I do. This is when it will take me an hour. I think, again, just as like a quick look through the table, this is a pigeon. It's not a whole scan. It looks like it's just the scan, right, of the head. So yes, I think there's 370 animal scans in here. That's probably on the low end. Nearly every dog breed is represented in here. So there's a number of different avid species that are in this table. So yes, we have those. I guess if you're wondering how this integrates not just into all the fun things that I teach, we can take a CT scan or an MRI scan from any one of our student athletes, perhaps, that has a tear, a major injury from a game. we can take that and we can turn it into the three-dimensional image that you see. So now, not just for the sake of the student athlete, but we can get our athletic training team on board to come up. Everybody looks at it, they see the changes, they see what the injury or the abnormality is, and then they know how to better treat that after the athlete has surgery or some sort of corrective procedure. There are the entire high resolution scan of the brain is in here. So for our psychology department, looking at neuroanatomy, we're integrating with them so they can see not just based on images or pictures in their books, but they can see the three-dimensional image of the brain and sort of how it integrates with the rest of the system. I know that they just put the reflex map on there, so we know where all the nerves and the potential endings are. That was just added recently. Like what else? There's 152 things later. Whatever, I'm like, I can't think of whatever courses we're using it in.
We're coming close to time.
So that's awesome. And then they also have a question about whether or not the heart function can also show hypertrophic cardiomyopathy.
I believe that it can. If I can remember where I put it. It does not. It has AFib, VFib, several different MIs, and almost all of the heart blocks. Doesn't have hypertrophic cardiomyopathy, which can actually be seen in some athletes. So that would be something I can ask Anatomage to put in here, because I think that's a pretty important feature. In closing, I will tell you that obviously you've seen there's an array of graphic material that is on this table. There's a simulation that was just recently added. And so although there's a number of people in this room who have experienced the simulation, from a student or a learning standpoint, it's pretty impressive. It's not for everyone. So yes, this is this happens to be one of the cadavers that is in the table. They were able to digitally alter this particular cadaver to appear as if she was carrying a fetus. Now, if you're looking at this, you're like, oh, I've seen simulated childbirth on nearly every medical TV show on earth, right? You can watch them all over YouTube, but what you can't do is, for us, right now, if you're looking at this from the outside, you're thinking nothing's happening, right? Like, I don't see anything happening. Hey. We can actually watch the simulation from the inside. So now, instead of just looking at it as an external activity, we can see the changes in the uterus, the changes in the cervix. You can see the changes in all of the abdominal organs as the delivery happens. And yes, at the end of this delivery, you will see the delivery of the placenta after the fetus as well. Before you panic, the fetus is a digital creation. The cadaver is not. Okay, so again, our science technology has allowed us to be able to view things like this so that students are better prepared when they're going into our higher level programs in medical science. It does not yet, but again, I'm going to guess that because, I mean, this to me is a pretty advanced digital creation. that it's going to be a matter of time. So what you might have noticed is during the delivery is that there's a rotation of the fetus during delivery. And sometimes you're right, that doesn't happen. Sometimes the fetus is breech. That means it's feet first. So I can see, because they've added so many different physiological components to this table, I can see that being something that they add in over time. That was a great question. Mike, thank you. I will leave you with a special thanks to all of the students that contributed to the research, as well as the faculty member in the biology and biochem department. And Derek Andrews is class of 26, hoping to go to PA school, did quite a bit of information hunting for our research process. So thank you.